Hello and welcome to Skin News. I am Joshua Fox, Board Certified Dermatologist at the Miami Center for Dermatology. And today we are fired up to talk to you about a paper that was in the Journal of the American Medical Association Dermatology in November 3rd of 2021. And the title is Association Between Melanoma Detected During Routine Skin Checks and Mortality. And basically what they did in this trial, this study, was that they looked at 2,452 patients, and they divided those patients into two groups. Half of the patients came to the dermatologist for a routine skin check, and then half of those patients came to the dermatologist with a complaint of a specific lesion, right? They said, oh, there's something right here I want the doctor to look at. And what they found was that of those patients who had a melanoma diagnosed, that is a cancer of the melanocytes, the patients that came in for a routine skin check had better survival compared to patients that came in complaining of a specific skin concern that they were worried about. Specifically, they found that of the routine skin checks, there was a 59% lower chance for death from their melanoma compared to the patients that came in with a specific complaint of for a lesion. And that was mortality due to the melanoma. Now, something called all-cause mortality was also lower. There was a 36% chance of a lower chance of death from any cause in the routine skin check patients compared to patients who came in with a specific concern of a specific skin lesion. Now, what they did also is they adjusted for certain prognostic factors, such as thickness of the tumor and the depth and so on. Once they did that, there was still significant improvement in survival in the routine skin check and all-cause mortality, that is, in just survival in general. However, death from melanoma then was no longer a significant difference between the two groups. But that makes sense because when you think about how likely you are to die from melanoma, the strongest predictive factor is how deep it is. So real quickly, just want to go over this model here. So here you have the skin, the epidermis up top, the dermis, and then the fat. So if your melanoma is caught very early, right here, it's just in the epidermis, it's called melanoma in situ. If it goes down deeper into the dermis, or God forbid, into the fat, then the chance of survival is a lot lower. So it would make sense that if you're coming in to your dermatologist for routine skin checks before the lesion has grown to the extent that you can actually see it and feel it and it bothers you, you're most likely going to have higher survival. So essentially what this study shows is it provides good evidence for us that going for routine skin checks to your dermatologist can improve your survival. I recommend you do that at least once a year, a routine skin check with your dermatologist. And remember that dermatology is more than skin deep. Thanks for coming by, and we'll see you soon.